Are we going to start from the beginning?
Yeah, sorry.
Okay, we're going back.
Sorry. Okay.
All right, we're ready. Yep.
Okay.
Just gonna keep going. Yeah. Just
Okay.
gonna go with it.
So we're starting with the posterior or lateral triangle of the neck. It's defined by the posterior border of the sternocleidomastoid, the clavicle, and the anterior side of the trapezius. So this is sternocleidomastoid here. And this is the internal jugular vein and the facial vein. Here we have the common carotid, and you can start to see the bifurcation of the carotid artery into external and internal, and you'll also see that on the anterior triangle as well. You have the hypoglossal nerve here, the posterior belly of the digastric muscle, and stylohyoid as well that runs right with that. Now here we have the submandibular gland and the facial artery. Here's the parotid gland over here.
Let me back up a moment. I think this is vein, and that this might be the artery.
Okay.
So just, you can see the difference in color.
Right. Okay. Okay, and here, going into sternocleidomastoid, we have the accessory nerve. And then, do you want to take over?
Do we cover the vagus nerve?
No, we do not.
No.
Okay. You can see the vagus nerve running with the carotid and with the jugular. Then we will go to the deeper muscles. We'll start out with the anterior scalene, which is actually right here. It is separated from the middle scalene by the brachial plexus, which you can see the thick band right here. This would be the middle scalene. Deep, you would find the posterior scalene, and towards the posterior portion here we actually have levator scapulae, and then at the very back you have, before or anterior to trapezius, you have splenius capitis. So that concludes the lateral triangle. Now we'll talk about 3 clinical presentations. The first would be atherosclerosis of the carotid artery, which would be just a thickening of plaque within the artery. Usually the diagnostic test for that would be using ultrasound. We talked about the parotid gland. One of the clinical presentations of mumps would be an enlargement of the parotid gland, which would actually have the ear to kind of flare out a little bit. And the final clinical application would hypoglossal nerve, thank you. If there's any damage to that, it's bilateral. You might have unequal tongue movements or difficulty with motor movements of the tongue. Now we'll move to anterior triangle.
I'll do the borders of the triangle, then you go into the muscles. Okay. All right, so we're gonna do the anterior triangle of the neck, and the borders for that are kind of the midline here, between the chin and the sternum. The lateral border is actually the anterior border of sternocleidomastoid, which we actually completely removed. The apex is the jugular notch because it's an inverted triangle, and the base would be the body of the mandible.
So next I'll show you the muscles of the suprahyoid and infrahyoid. Like Dr. Willem talked about in class, these muscles are named based on what they're attached to. So think of this as like the sternal region, the thyroid region, and the hyoid region. This muscle is called sternohyoid, and lateral to that is omohyoid. Okay, so if you under that,
Nice.
this is the sternothyroid muscle, and this is the thyrohyoid muscle. These are the thyroid. This is the isthmus, and this is the right lobe. The left lobe you can't see, but the isthmus is what connects the two lobes. Next, these are the suprahyoid muscles. Right here is going to be the mylohyoid. And here is the anterior belly of digastric, which they showed you over here, but on that side, but this is the posterior belly, digastric right here.
Should we just mention that this is the thyroid cartilage here?
Sure.
All right. And over here we have a better view of the external jugular vein. But really what we want to show you on this side is the common carotid and then the branches off the external carotid. So Ben, if you want to come over here, it might be better. Can you see down in here?
As good as we'll be able to.
I would come over here, Ben. You could see them all better. All right. So, right here is the bifurcation of the common carotid into external and internal branches. Right there, you have your carotid body we talked about in class. So right here, actually we'll go the first branch off of that, is the superior thyroid artery. Moving down, we have the sublingual.
It's just lingual.
Lingual artery. This here is your facial artery. This here, occipital. And it keeps going down. Correct me if I'm wrong, but this one we cut here we believe is the postauricular.
Okay, yeah.
And deeper down, we weren't able to identify, but we believe somewhere in this kind of hole here would be the maxillary.
Okay.
And then that all ends into one big terminal branch of superficial temporalis, or temporal artery.
I'm wondering if that's your superficial temporal coming up to the lateral side here, and that might be your maxillary. Diving down deep, because anything coming off of this superficial temporal is really superficial, and this is starting to dive pretty darn deep.
All the things I just said.
And I'm not seeing a whole lot else happening
But
there.
there's like we'll see
That might be the little auricular branch.
Okay.
But that could be superficial temporal.
Okay.
But this is really nice. Nice job.
like she said, what's